People don't always want to talk about their mental health issues with a person because they might feel some shame around it. But they actually feel more comfortable sometimes talking to an AI because they know the AI is not going to be judgmental. And so we take advantage of that to let the person know, like, hey, this is a confidential setting. Nobody's judging you. Feel free to explain to us the background of your situation so we can best help you. And people will open up and share. And then that allows us to better route them to the appropriate services and to the right next step because of that willingness to interact.
Somebody was telling me, I was touring a call center, and they said that some of the elderly patients waited till after 5 for the AI because they didn't feel comfortable sharing some of their personal details with the live human.
And we can detect that that is happening. And then because of that detection, we can now route them to the appropriate emergency response workflow and protocol. And number 3, we can help improve the quality of life of that patient.
Welcome to the Contact Center Gurus, the podcast for contact center and customer experience leaders. Learn best practices, new technology, tips and tricks, and more. Listen in.
Welcome to the Contact Center Gurus podcast. I'm your host, Darren Prine. And today's episode is called Stop Buying Chatbots, Start Deploying AI Agents. Most healthcare contact centers have tried chatbots and been burned. That skepticism is earned. But what's possible today with AI agents is dramatically different from what those early deployments were. And most CX leaders don't have a clear picture of what actually changed or how to measure it. That's what today's episode is about. By the time we're done, you'll know exactly what to look for, what questions to ask, and what good actually looks like in a regulated environment. My guest today is Rebecca Clyde, co-founder and CEO of Botco.ai. Rebecca has spent nearly 2 decades building companies at the intersection of marketing, technology, and healthcare. She co-founded Ideas Collide back in 2006 and grew it to a $10 million agency before turning her attention to a problem she kept running into with clients. The AI options for regulated industries like healthcare and pharma were either too generic to be trusted or too rigid to be useful. So she built something different. Botco AI handles over 90% of customer inquiries autonomously for healthcare and pharma organizations. It's built from the ground up for regulated environments. We're talking HIPAA compliance, audit logs, adverse event detection, the full picture. Not bolted on after the fact, built in from day one. What really got my attention is the work they're doing now at UCLA Health in oncology, where the metrics they're being measured on aren't just resolution rates. Their quality of life outcomes and clinical utilization. That's a different conversation than most AI vendors are having. Rebecca, welcome to the show.
Thank you, Darren, for that introduction. I'm so happy to be here with you today.
Well, I'm glad to have you. And I think people are going to learn some things today that are going to blow their minds and really open their eyes to what's possible now with AI. So let's get started. The word chatbot has become almost toxic in some contact centers. Leaders tried them, got burned, and now they're fighting internal skepticism every time digital automation comes up again. In healthcare, where the stakes of a wrong answer are so much higher than in most industries, what actually went wrong with those early deployments?
Well, the reality was that oftentimes those deployments were being created not by people that were familiar with the patient needs and the patient life cycle, but a lot of people that worked in IT and technology. And so they had very rigid decision trees. They were often only able to handle 2 or 3 types of inquiries or requests. And so this meant that the customer experience was very poor. Um, Oftentimes, because of the siloization of organizations, the people who were implementing these chatbots were not really the subject matter experts about the content that those chatbots needed to be able to handle. And so there was always a mismatch in and patients, the ultimate customer, failed to find any usefulness out of these. And so the projects tended to fail. And then, in general, chatbots got this like poor record um, because of the way that they had been implemented and what was really available to use during those early days.
Yeah. It used to feel like it was rigid workflows with if
Yep.
then statements kind of built in or logic built in. And unless it was very specific to what somebody wanted, they weren't getting the answers or resolution that they had initially planned on or hoped for. And so then they would walk away thinking that, AI is dumb. And from my perspective, where I've seen some of the most advanced AI on the planet, and I've seen it handling super complex interactions, even with background noises and babies crying and all kinds of, and it actually being able to resolve the issues as well, or in some cases, better than a human. So I know what's possible, but I also understand what people have been seeing in the past and how
Mhm.
frustrating that's been for them. So,
Absolutely.
walk me through the behavioral health story first. You had a group with 25 locations that built a whole live chat backup system, expecting constant handovers from the AI. And in the first 3 months, they had almost none. What happened there?
No, exactly what you're describing. So they had a champion within the organization that said, "Hey, we're getting a lot of calls and inquiries after hours, on weekends, and even during the regular business hours. We don't want people to wait. This is a mental health crisis that we're going through in our state. We want people to get help right away." So they partnered with us to deploy a chatbot that could instantly handle any inquiry that came in. And of course, being a healthcare organization and thinking like, "Hey, there's no way this chatbot is going to be able to handle everything. We're going to have these live agents on standby, waiting to intervene or pick up conversations where the chatbot gets stuck." So they invested in that live handover capability. But we did a really good job together partnering in terms of training it on really good content. We analyzed their call center transcripts to understand what is the nature of the calls that typically come in. And we made sure that when we deployed this chatbot, it was able to handle, a wide swath of the types of questions and inquiries they received. One thing that we did that is very unique, and I think our callers need to understand, is that in behavioral health and healthcare in general, we have to have detection systems for crisis or emergencies. So we even built into this product, into our system, the ability to understand if somebody is in crisis, if there's a risk of harm to self or others, because we need to be able to direct those people to a different protocol, a different workflow, if that's the case. Um, so we launched, we went live, and these agents were waiting to get all these handovers, and because we were resolving issues and getting people their appointments and answering their questions, getting their insurance inquiries dealt with, sending anybody that was in crisis to the appropriate crisis response teams, there was very little for the live agents to do. And they ended up being able to completely reallocate that budget that they had set aside for a live chat system to other projects because it was no longer necessary within their organization. So, there we helped them with two things: take resolution time down to practically zero for all of their inquiries, whether it was on a Saturday at midnight, or a Monday at 2 p.m. It didn't matter because we were there for them 24/7. We also provided multilingual support, which meant you didn't have to wait for a Spanish speaking or another language speaking uh, phone person to be able to answer. We could support multiple languages, and we were getting them to the right services and to the right appointments that they need. So this is an example of a customer that is still our customer to this day. They continue to grow and add more locations. And as a result of the success we had on the chatbot, we're now implementing the same system in their voice contact center as well, so that we're not just there on their website, but we're also there anytime somebody calls in. They will have the option to interact with our system as well.
right? So it's the same voice essentially, or branding and messaging, whether it's voice or digital, because it's the same
Exactly.
platform for both. So my understanding of your of what you just shared is here you had interactions that the client thought were going to be too complex for AI. They had all these humans ready. They even thought that the interactions would be difficult for humans and that there'd be some research and so on that would need to be involved. But then the AI outperformed what they thought was possible and actually was able to handle most of the interactions without needing to hand over to a human. Is that right?
Absolutely. That's exactly right. And, a lot of that was possible because we came in with a lot of experience already in behavioral health.
Mhm.
So we had built a really strong capability in saying, hey, we know the kinds of questions that come in. We know that when people are interacting, they are not in their best moment in time. They're actually sometimes at their worst. And we are used to understanding how people interact. What are the types of questions? What do they actually mean when they say certain things? They may use the wrong word, but we know what they mean. And so we were able to very successfully and empathetically take those patient inquiries through the appropriate workflows. One other thing to know about behavioral health and healthcare in general is there's often a lot of stigma around these types of requests. People don't always want to talk about their mental health issues with a person because they might feel some shame around it. But they actually feel more comfortable sometimes talking to an AI because they know the AI is not going to be judgmental. And so we take advantage of that to let the person know, like, hey, this is a confidential setting. Nobody's judging you. Feel free to explain to us the background of your situation so we can best help you. And people will open up and share. And then that allows us to better route them to the appropriate services and to the right next step because of that willingness to interact.
I've heard that before. I've somebody was telling me I was touring a call center, and they said that some of the elderly patients waited till after 5 for the AI because they didn't feel comfortable sharing some of their personal details with the
Oh,
live
yeah.
human. And I look at the times where I've called, for instance, to book a colonoscopy, and I don't enjoy when I'm having to tell what's clearly a young girl what my problems are and why I'm wanting a colonoscopy. I would take an AI 10 out of 10 times over
Uh,
having to explain my situation to a young girl. That
oh,
is
exactly.
uh, I feel you. This is
Yep.
great.
It
Um,
happens to all of us. None of us wanna talk about those intimate details with another person. That's
right.
strange.
Exactly. Especially with someone that's young and of the opposite sex, it's just weird
Yeah.
and uncomfortable. So most people think of AI in the contact center
Mhm.
as something that answers questions or whispers suggestions in an agent's ear. But you describe something different, where the AI is handling the workflow that used to follow the conversation too.
Mhm.
Um, what does that look like in healthcare, and why does it matter?
Oh, absolutely. I mean, there's so much regulation in healthcare, that has to be understood and followed to a T, and this is something that we have really specialized. So I brought up one example, which was crisis response. If in an interaction, the person happens to mention something about potentially harming themselves or a risk of harm to others, and they may slightly mention it. It may not even be an overt reference, but we can pick up on cues where we can notice that this person is probably in a on the path to self-harm or harm to others, and we can detect that that is happening, and then because of that detection, we can now route them to the appropriate emergency response workflow and protocol. And every health system has their workflow that says, okay, if the person is in crisis or if this is the situation, this is the workflow we want followed. So that's one example. Another one might be if they took a certain medication and they had an adverse reaction to that medication. There's a very specific workflow that needs to be followed in that situation. We need to collect more information. Was there other medication that was being taken at the same time? Was there alcohol being consumed at the same time? There's a lot of things we need to collect to understand. what exactly is the urgency of that situation? Is this something where the person needs to go to the emergency room right away? Or do we just need to do a triage over the phone, or just route them to an appointment, right? It can be very nuanced
Mhm.
depending on what they brought up. And so because the AI is trained on the depth of knowledge around every medication, every potential adverse reaction that could possibly have happened. We've analyzed all the clinical studies for those types of medications, so we know what are the typical ones and which are the atypical ones. We
Mhm.
can then prompt the user to take the appropriate next steps. Whereas, a call center agent couldn't possibly remember the millions of adverse reactions that exist for the
Right.
thousands upon thousands of prescription medications that exist out there. So it would be mentally exhausting for anybody to try to remember all of that. But our AI can and will appropriately develop the case and workflow for those types of examples. So I just gave you two: crisis response,
Yeah.
adverse reaction to a potential medication situation. There's many more, but those are the big ones.
Yeah. And this is much faster than a live agent having to search their knowledge base
Oh, yeah.
to then do a search to find,
They can
again,
probably
the
not even
adverse
spell the
reactions and all
medication.
of that. Much more efficient. Um,
Exactly, and think about medication, you may spell it wrong and give the wrong information, right? So the AI, if the agent doesn't even spell it appropriately, they could have given the wrong instructions. So we have the ability to, double check it to make sure, okay, is this the medication? Is this what you were taking? What else were you taking as well? And making sure that we are providing the right and the appropriate next step. Mhm.
yeah. And does this also tie into the guidelines as far as what AI can or can't say? Because I imagine that's super important in this environment.
Oh, absolutely. With every implementation we have, which we train the AI on the do's and don'ts of what it can do, the guardrails, we call them. And for really good guardrails to be set up, we have to give positive examples and negative examples. So we'll say, for example, in this case, if it's a certain type of situation, we don't want you to give diagnostic or medical advice, but you can suggest these kinds of things, right? So we go through a lot of work. We work very closely with the clinical teams with our customers to ensure that the AI is trained on the do's and don'ts. And we test it very vigorously to ensure that it doesn't go off the rails before we go and take anything live.
Yeah. You wouldn't want the AI recommending methadone for someone with a headache.
No, no, never. Yeah, absolutely. And we have, with, for example, one of our customers is UCLA, and we're, probably going to talk about that a little bit.
Mhm.
But they actually trained the system that we work with them together for oncology patients on their own knowledge base of evidence based, research approved, um, what they would call recommendations for patients who might be experiencing certain symptoms or side effects to like chemotherapy or radiation treatment. So in their case, they actually did want clinical responses, but they wanted it to be from their approved, research based content, not from Dr. Google or some, chat GPT output
Mhm.
that they couldn't really reliably source.
Makes sense. I can't help thinking, and I think it was my second question to you, where you shared how your AI outperformed the outcomes, that the client was expecting, and very few interactions ended up having to go to a live agent. So I imagine in that situation, you have to be really good at not just ingesting all of their data, but being able to contextualize it really, really well. How do you do that?
It comes from just having been very experienced in this space. Again, what helps us is when we have a lot of customers in a certain category, and this is why specialization becomes very important. We start to understand common themes. So we have within our system capabilities that understand for different disease sites, for different types of practices, what are those questions? How do people convey information? We even start to understand regionalisms. For example, we have customers in Florida where a lot of their customers aren't speaking English or Spanish, they're speaking Spanglish, and they're mixing languages within an interaction. Well, we had to be able to train our AI to be able to answer questions that were coming in Spanglish, which isn't even a real language. And so, again, it just comes from having a lot of data, a lot of experience in this space, being able to do thorough analysis on the types of interactions that are happening in the real world, testing vigorously, and then building that really strong posture that is very specialized around those healthcare, service lines.
Excellent. So you mentioned something I haven't heard from any other vendor, an audit log that shows not just what the AI said, but why, what sources it drew from, how those sources were weighted, who uploaded them, and who approved them. All of it traceable. In a regulated environment like healthcare, why does that level of visibility matter? And what should a CX leader be demanding from any AI vendor before they sign anything?
Mhm. I'm so glad you brought that up because we spent a lot of time investing in that capability within our product, and I don't think it always gets as much appreciation. So I'm grateful that you called it out. Because it's true, it's not a widely available feature. I certainly haven't seen it used. And this is
Mhm.
actually something we co-created with our customers. So what happened, and I'll tell you the story, is we were trying to sign a big healthcare customer, and of course their compliance and legal team spent a lot of time with us, and they said, if we get taken to court because of something the AI said, and if this had been happening in the news, right, there had been stories in the news where companies were being held to what their AI chatbots were saying. They said we need to have an audit log, and we need to know exactly why the chatbot answered a certain way. And we were like sweating bullets, going, "Okay, that's a big ask." But my team is my CTO is amazing. My the technical team is always up for a challenge, and we said, can you give us a few weeks? We're going to figure out how to do that for you. And if we come back to you with an example of how we could do that and it satisfies you, can we move the project forward? And they said, okay. They thought probably we were never going to come back to the table. And sure
Yeah,
enough, we came
big
a few
ask.
weeks later. They don't know that we're scrappy entrepreneurs. We don't take no for an answer.
Mhm.
And we exposed the reasoning models within our product, and we provided, because we were logging in SOC 2 compliance. You have to log everything anyway. So in our backend systems, everything is being logged when somebody uploads a piece of content, when the AI references a piece of content, the weighting structure that we use within that content to provide an answer. That's all stuff that we're doing within our algorithm already. It's just usually in a black box and people don't like to expose it. So we had to think about what's the best way to expose this in a way that it can be understood by non-technical people, and how do we show it so that the legal and compliance team can approve it and feel comfortable moving forward. So it took a couple of iterations to get it to a point where it was consumable data, right? Because that's the hard part, is how do you make that data actually consumable and visual? So we had to do a few iterations, and we came back and they said, oh, this is actually perfect. This is better than anything. I wish I had this for everybody's reasoning in their own heads of like, why did you do that? Well, here's the reasoning model.
Yeah.
Here are my notes. So, we had to find a way to show the work and show it in a way that was consumable, which, is not always easy to do with technical data. But we figured it out. And now we have a whole panel within our chat platform, our Botco.ai platform, in the dashboard, where you can click on a conversation, you can click on anything that the AI said, and then it'll show you exactly every piece of data associated with that particular response that the chatbot gave. And that way, if compliance and legal says, "Hey, we have a patient that's complaining about this answer. Can you show us the work? Why did the bot say this?" We can show them the work and they can see exactly the provenance of every single utterance that the chatbot made.
That is so impressive. I mean, Cloud Dead Gurus has invested over 4,000 hours evaluating over 1,000 vendors. We spend over 50 hours a month evaluating new vendors. We want to be more in the know on vendors and have more vendor intelligence than anybody else. We're looking at AI companies constantly. We're doing trainings with our AI partners for our gurus who are all consultants. And not one has ever told me about what you've just described. It's possible that nobody else has this right now. If they do, you'd think they'd mention it because they'd want us to promote it. And they'd want to make sure our clients are aware of it, and it has never come up. So it's
Mhm.
possible that you have a window of time now where you're the only one that has it.
I think so too. And like I said, the hard work was really in figuring out how to expose it and make it consumable because the
Mhm.
data is always there. It's
Yeah.
just in such an unconsumable format that it's hard to fetch and hard to show. So I think that's why most people just probably skip that step because it's too much work, honestly.
Yep. So, last question for a healthcare CX leader who's ready to move forward on this. What's the mistake you see organizations make that kills the project before it ever delivers?
It always comes down to human collaboration. And the organizations that I see that succeed the most at this bring to the table all of the key players to make this work. They understand that AI is about de-siloing your organization structures in a lot of ways. It's about making sure that compliance and clinical operations and safety and customer support are all in the same room talking to each other and sharing knowledge so that we can train this AI brain, right, to have the expertise of every single one of those stakeholder groups. And when we collaborate with the teams and we work together to ensure that all of those systems are talking to each other, that the AI has access to the data, to the workflows, to the appropriate content experts to test these systems, that's when we see success really, really happening. When I see these projects fail, it's because certain teams are kept out of the loop because maybe there wasn't a good socialization within the organization of bringing together the key stakeholders. Maybe compliance wasn't in the room, maybe safety wasn't in the room, maybe clinical operations got pulled in too late, right? That's when I see these things fall apart. And so AI, it's not going to solve all our problems if, as humans, we don't get in a room together and really think through the full journey and that full experience and making sure that we are training and testing as best as possible to provide an amazing customer centric experience.
Love it. Before we go, I want to get back to the UCLA oncology work
Yes.
that you guys are doing. And I know you touched on it, but maybe kind of give us a bigger example of what you've done for them and the outcomes that they're experiencing.
Absolutely. I have just been so pleased and to be working with this institution. University of California Health is one of the largest and most prestigious health institutions in our country. And I'm so honored that they chose us to be part of their AI, uh, ex- uh, not just pilot, but their AI pioneering efforts in the healthcare world. The reason they came to us is because they were looking for something that was really robust and um, h- built from the ground up for healthcare specifically. And they're using us in two different settings. Number one is for clinical trial recruitment and enrollment. Because they're a massive research institution, they're running thousands of trials across their health systems on any given day. And there's no way that any of their doctors who only have 10 or 15 minutes with a patient at any point in time can possibly remember every trial that might be appropriate for that patient. And so they asked us for an AI system, a chatbot specifically, that could be in their pocket on their phone, where they could just quickly answer a couple of questions and the AI would recommend the appropriate clinical trial for that patient. And we had to figure out how to do this privately and securely and all those hard things. Um, but that was the first implementation with them. And they're actually studying it right now at UCLA as our chief sponsor in the oncology department to help them increase accrual rates and help bring to market more of these life-saving treatments for cancer. So that's number one. Number
So is part
two,
of that kind of like doctor assist, where the doctor is
yes,
able to
exactly. That's the
utilize the
doctor's
AI
chatbot.
and then come up with those examples from previous case use cases, case studies?
Mhm. That's a doctor assist AI capability, exactly.
Amazing.
And they can even refer patients to trials that are not within their health system because they may say, oh, there's a clinical trial going on at City of Hope or at Cedar Sinai or at Stanford Health, right? Because there's
Mhm.
a lot of other health systems there. The wonderful thing about medicine is that they just want to get the patient to the life saving treatment, and they are, they may have already done everything that they can do at their hospital for that particular patient, and if the next best option is at a clinical trial at a different health system, and the chatbot says, "Hey, you should really recommend this patient to this trial. Would you like me to?" All they have to do is say yes, and we automate the referral process and kick off the enrollment for that patient for them. So they don't even have to go back to their desk and do a bunch of paperwork, which is the thing that doctors don't like doing.
Right.
So that's our one of our implementations right now over at the University of California Health System. The second is a patient support system, and this is a system called Ask Grace, and Grace stands for Guided Recommendation Assistant for Cancer Engagement.
Mhm.
And, one of the things about cancer is that because people are living longer now and these treatments are working, um, doctors now have more and more patients than ever. And they're getting all these phone calls all day long about their symptoms and side effects. And they said, you know what, if we could give an AI companion to our patients who are undergoing maintenance treatment on these oncology therapies, it would help. Number one, get the patient an answer much faster because sometimes it takes us 3 or 4 days to get back to them. So they can get an answer right away. In less than 30 seconds, they'll have an answer. And number two, it'll take down, reduce the number of incoming calls that are barraging the poor clinic,
Mhm.
right? And number three, we can help improve the quality of life of that patient because the faster they get the answer, the quicker they can implement the recommendation and the sooner that they will feel better and they will
Right.
feel supported. They won't feel like they're being ignored. And one thing in the world of healthcare is people's feelings actually matter in their healthcare. How people feel, if they're feeling supported, if they're feeling like they're being responded to, they're going to get better faster. And so having this AI companion for these like PARP inhibitors that are being used in oncology is making a big difference. So they're actually studying right now the impact of this AI companion that is provided by Botco.ai on quality of life metrics, fear of recurrence metrics, and then also clinical utilization metrics as well. So we're being held to a very high bar over there. But I love it because those are ultimately the metrics that matter. It's not so much how many calls came in, but it's did we help people feel better? Are
Mhm.
are their lives better because of our product? And
Yeah.
that's the most important question we all need to be answering in healthcare.
And there's probably situations where, doctors make you feel like they're really, really busy. And so sometimes, before they escape, that's how that's what I call their exit. When a doctor, their
Exactly.
escape. Before that, maybe there were some questions the patient wanted to ask, but didn't feel like they should. The doctor's busy, but with the AI, they can get all their questions asked and answered in,
Exactly, and there's no end. They can just keep going for hours
yeah.
and hours. It never gets tired of them, and it can switch languages. We can provide it in multiple languages. We can keep going and going, and it's a very rich interaction. It includes video, content as well, so they can watch little videos to help them. They can read the content if they prefer. Sometimes people aren't feeling that great, so they don't want to read, especially if their eyesight is compromised, which is why we provided audio and video enabled content too within the chat interactions to answer people's questions. And they can be embarrassing questions. And we see a lot of questions about, not such lovely side effects that people might be feeling, which again, they might be embarrassed to talk about even to their doctor. And here, this is a nice private, personal interaction channel they can use where nobody's going to judge them about, a digestive problem or something like that. That's not very, fun to talk about. Mhm.
I think 90% of people want that. I think we would all I would like I'm with Banner Health. I wish that there was a system like that right now in Banner Health that I can just talk to about all of my issues and and even if it's just to feel heard. But
Exactly.
if on top of that
Exactly.
it gave me some direction or guidance that was useful, that would make it
Mhm.
the greatest health plan in the world.
There you go. I'm gonna send this quote over to them right away. I actually have a call with someone with Banner Health later today.
I'll help you. I'm connected to their head of CX. So awesome. Well, this was wonderful. Love what you guys are doing. Certainly, I'm going to say that, it's hard to say in the AI space that anyone is disruptive, but you're right there on the cusp of disruptive. The audit that we talked about, you're the only one I know of that provides that. So you're right in there in the disruptive, semi-disruptive area of
Mhm.
AI. Certainly what you're providing is very impactful, so I think that's what businesses care about, and certainly it's what their patients care about. So this was wonderful. I really appreciate you sharing your time and your wisdom with our listeners.
Of course, Darren, it's my pleasure. And if I can answer any other questions, feel free to reach out to me. I'm here
Yeah,
at
and
Rebecca at
we'll
Botco.ai.
throw up here. My marketing person will put up something as to how people can contact you, or how they can contact Cloud Tech Gurus if they want to actually see a Botco demo or learn more about how that could work for their organization. So I'll make sure all that info is shared. And again, thank you kindly.
Of course, my pleasure. Anytime.